What are the most common causes of hair loss in men and women?
So the most common cause overall of hair loss is always going to be genetics. Another word for hair loss is androgenetic alopecia. So this can come from either side of the family. It can come from a man or a woman. And since you're not a clone of those family members with hair loss, the year it starts, the speed, the severity, and how bad you'll end up before the age of 100 can't be predicted. There's a lot of risk factors that are also involved with genetic hair loss. The big one is age. Every decade that we age, our risks do go up by at least 10% or more. But there's also a lot of hormonal factors. People that are on testosterone, it can accelerate your hair loss. Women with PCOS, when women begin going through their menopausal years, that also creates a shift in their hormones that can trigger genetic hair loss or make it worse. And there are others like thyroid. If your thyroid is balanced on medicine, that's not an issue. But if your thyroid is imbalanced, that can certainly cause a lot of hair loss. The other most common cause of hair loss, which is still less than genetic hair loss, is called telogen effluvium. That is a fancy word for stress-induced shedding. What happens is, and there's a laundry list of causes, once there is a stressor inside the body, as a reaction, your hair seeds begin to push out the hair shafts. Those hair shafts go on vacation for a while, and until the stressor is found and removed, and oftentimes it's just time that is required to heal, those hairs will safely come back. The biggest mistake that I see in my practice is that everyone assumes their hair loss is due to stress when it's actually genetic hair loss. Having said that, you can actually have genetic hair loss and then have periods throughout life with stress-induced shedding. So that can make your genetic hair loss picture look worse. Very common causes of stress-induced shedding would be nutritional imbalances, whether it's crash dieting, a lot of these new weight loss drugs that cause massive weight loss in a short amount of time. There's also issues if you have inflammation in the body, if you undergo anesthesia, hospitalizations, illnesses, the list goes on and on. The big ones that I do see in my office are usually more nutritional issues. Low iron, low ferritin, vitamin D, B12. These are just some of the labs that we always need to test to ensure that they're optimal for your hair health. A very common one, as I mentioned before, is thyroid. A lot of people will not have symptoms, or they will have symptoms but don't know why they feel the way they do. And then when we check their thyroid, we find out that there is an imbalance in their thyroid function. Once we can get on the proper medication, get the labs back to normal, those hairs will recover. So thyroid imbalance would be more under the list of stress-induced shedding.
How much hair loss is normal in a day?
So the average amount of hair we lose in a day really does depend on the person. Typically, you'll read that it's anywhere from 50 to 100 hairs per day. But again, someone could have 38 hairs that they lose in a day. So if someone's losing 38 or 40 and now they're losing 80, that actually is a problem because you've doubled the amount of hair you've lost. So hair shedding is very difficult to say that it's one size fits all. But on average, we have about 100,000 hairs on our head. And on average, anywhere from 8 to 10, maybe even 12% of our hairs are going to leave every day. The reason why is the hairs you see today were not there a few years ago. The average hair cycle is anywhere from 2 to 6 or 2 to 7 years. So that's why you're going to start to see hair shedding every day. Thankfully, our hair seeds were not born on the same day. If that was the case, every 2 to 6 or 7 years, all the hairs would fall out and we would have to wait 3 to 4 months for them to return. So think of hairs as having asynchronous birthdays. They're born on different dates. That's why we lose only a small amount per day. What I often see is when people start to notice that they're losing their hair more, they start washing their hair less. They somehow believe that the manual manipulation with their hands is what's pulling their hair out. Guys, your hair has the strength of 2 elephants. You're not pulling your hair out. You're having your standard shedding, but if you actually have a hair loss disorder, it is going to disrupt that cycle where instead of only 8 to 10 or so % of your hair shedding every day, that number can continue to climb. That is when it's time to go see a doctor.
Is hair loss always genetic? Can lifestyle factors contribute?
So when we take a deeper dive into genetic hair loss, for 97% of men that have a hair loss concern, it is genetic. For women, it's around 40 to 50%. But as stated earlier, genetics isn't the only reason why we actually have genetic hair loss. There are about 287 genes that work together to create hair loss. We also talked about age being a risk factor, but the big one that is not talked about enough is epigenetics. Epigenetics is essentially what we do with our lifestyle and environmental factors that dictate how our genes are expressed. So you can have a patient who has genetic hair loss on both sides of the family, but they're not necessarily going to have the exact same hair destiny as what they're seeing in their elders. If you treat your body better, there is research that shows that your genes will be less expressed. So when we talk about lifestyle factors, we're talking about the basics: how we sleep, how we treat our body with food, alcohol, tobacco, and also just in general, are we working out? Are we able to eat healthy foods? Because we do know that we are what we eat. If we think of hair as an organ, it is one of the most sensitive organs we have, but it isn't the most pivotal. When we eat, our nutrition is going to go to the more vital organs: your brain, your kidney, your lungs, your heart. So think of the hair as more down the line. It's going to get whatever's left over. So when we are eating, it is always best to follow an anti-inflammatory diet, rich with a balance of protein, carbohydrates, and fats. And the best diet overall is going to be a Mediterranean diet. The anti-inflammatories and the antioxidants in there will help calm the skin as well as calm the entire body. And then having these good fats and these good proteins, they're all going to contribute to the richness of what your hair is going to consume.
Can certain hairstyles or treatments cause hair loss, like tight ponytails, extensions, dyeing, etc.?
For men and women that use braids, ponytails, cornrows, or even extensions, we just have to be careful about the long-term ramifications. We're not saying that every person that uses one of these hair care practices will have hair loss, but there is a form of hair loss called traction alopecia, and there's two different stages. If you give your hair a break, if you will, without pulling, a lot of times if you are noticing some thinning, by giving it time to heal, those hair shafts will recover. But if you're constantly using a certain hair care practice that pulls the hairs pretty tightly, eventually it can disrupt those seeds and lead to complete baldness. The reason why is in the name, traction. If we have a lot of traction or a lot of pulling, it puts a lot of intensity on the actual hair shaft and hair seeds at the same time. So when I have a lot of patients that come to me, for example, that have a receding hairline from long-term use of ponytails or braids, the first thing we're going to ask is to give your hair a break. We still may need medications to help rebuild them, but we know that if we go back to doing the exact same thing we did that caused it in the first place, this is going to be a never-ending cycle, which can eventually lead to permanent baldness.